For more on the economic impact and the human impact of the coronavirus, let's bring in our guest, Dr. Mark McClellan. He is the director of the Duke-Margolis Center for Health Policy at Duke University. He's also a former FDA commissioner, and he is the former deputy assistant secretary for economic policy at Treasury. So, Dr. McClellan, you may be the person who can best tell us what both the human and the economic impact of this is going to be. First of all, address Steve's point that the information that we're getting, we're trying to have to make this up on our own. Where do you think the situation stands right now from the best information you've gathered?
Well, the situation in Wuhan is going to be difficult for quite some time to come, I think. The local public health authorities are pretty overwhelmed with cases. They have, as you mentioned, developed a new method for counting cases because there's not availability of the kind of gold standard test for detecting whether someone has the virus or not. And there clearly are a lot of continued containment efforts underway that are going to have a big impact on the economy in the area and hopefully will help contain the spread of the virus locally as well.
We had an official on from New York City earlier today just asking what the preparations were. He said at this point they have not started trying to amass any sort of testing units that we could be handling if we saw an outbreak here in the United States. How prepared is the United States, and have we learned from past experiences with SARS and other situations?
I think we definitely have learned. There is a lot of preparation going on now, led by the CDC in collaboration with other agencies throughout the federal government. They are preparing additional supplies. The CDC has already made a pretty rapid diagnostic test available throughout the U.S. to local public health authorities so that when suspected cases come up, they can be tested rapidly within a few hours, and containment procedures, isolation, quarantine if necessary, can be implemented. This is a very different situation than what China is facing, where we are aware of the challenges that could be coming and have some preparations in place to help contain it. But I do think we are still in a difficult period here where the virus could spread, and it is important to go ahead with these kinds of preparations.
Let's talk about the economic impact, or at least our best guesses at some of these situations. Clearly a huge economic impact for China. Do you anticipate that will end up having an impact on our economy?
It could. You know, our economy is diverse, it's large, it involves trade with China, and there will unquestionably be some impacts, but I think those can be dampened as well. And in the United States, I don't think anyone here needs to be making plans now for significant direct economic disruption from the virus because all of these preparatory steps are in place. I do think it's going to be with us for some time, and you all may remember there have been outbreaks of new viruses before, H1N1 just in the last decade, before that SARS. This is probably more like an H1N1 case, maybe a little bit higher mortality rate than that for people who are have a compromised immune system or lung problems or elderly, but it's not as bad as SARS in terms of fatality either. So we've made it through viral infections like these before, and hopefully the containment will prevent this from becoming a widespread infection in the United States.